I'm Fiona Forbes for InvestmentPitch Media. Thank you for joining us today. Reliq Health Technologies, a rapidly growing global healthcare technology company developing innovative virtual care solutions for the multi-billion-dollar healthcare market, announces record revenues of $12.6 million for the calendar year of 2022. The financials for the quarter ending December 31st, 2022, and management's discussion and analysis are available on sedar.com. Dr. Lisa Crossley, CEO, stated the company achieved record revenues of $4,118,524 for the 3 months ending December 31st, 2022, and $12,683,030 for the 12 months ending December 31st, 2022. Software and services revenue continues to increase as percentage of total revenue, increasing over 229% to $1,727,817 relative to the 3 months ending December 31st, 2021. This is consistent with the company's previous guidance that high-margin software and services will account for the majority of its revenue in 2023 and beyond. As discussed on our last webinar in January 2023, the company has prioritized increasing the pace of collections and reducing the time to adherence for patients. Over the last 2 months, the company has made significant progress on both initiatives and expects to be current on accounts receivable and to have taken over management of adherence for all new and existing clients by the end of the fiscal year. Sales for the 3-month period ending December 31st, 2022 increased by 90% to approximately $4.1 million over the approximately $2.1 million reported for the 3-month period ending December 31st, 2021. Revenue from software and services for the 3-month period ending December 31st, 2022 more than tripled to approximately $1.7 million over the approximately $500,000 reported for the 3-month period ending December 31st, 2021. Going forward, the company expects the majority of its revenue to come from software and services versus hardware sales. Gross profits for the 3-month period ending December 31st, 2022 increased 121% to approximately $2.6 million over the approximately $1.2 million reported for the 3-month period ending December 31st, 2021. Gross margins for the period were 62% due to a temporary increase in device costs, which has subsequently been resolved as the company added new device suppliers. Gross margins are expected to reach 75% in calendar year 2023 due to reduced device costs and an increase in the percentage of the company's total revenues from higher margin software and services versus hardware. Loss for the period decreased by 97% to $71,000 for the 3-month period ending December 31st, 2022, from the $2,155,000 reported for the 3-month period ending December 31st, 2021. We caught up with Dr. Crossley at a conference this morning where she discussed a few additional highlights from 2022.
We've signed last year a contract with Cognizant. Cognizant is, depending on the market in the day, about a $45 billion market cap company. They're in Fortune 500. And they are working with us on 2 fronts. One is joint business development. So we do joint sales calls to their very large healthcare organization, insurance company contacts. They also offer care management. So we have a care management team. But we have had instances where very large clients have expressed concern about our ability to scale that care management team as quickly as they might like. Cognizant has an established global care management team. So if we need to be able to scale very, very rapidly, Cognizant can help us do that. It's the same cost as if we hired those resources in-house. So it's a win-win for us. But in the market, either in the healthcare market, it's a very conservative space, and having an alliance with Cognizant where they've vetted us, they've done their due diligence, has been hugely helpful for us since during some of the larger clients who are very reputation-driven, let's say. And he signed a physician network in Florida I think it was August last year, that has 50,000 patients. They'll be onboarding to the platform this year. And we've signed, it's actually up to 189 skilled nursing facilities in Florida. And I think we've got 1 in Pennsylvania and 15 in California. So we're rapidly expanding into the skilled nursing facility space. It's a space that's under a lot of pressure from Medicare and Medicaid to reduce length of stay for patients, but also to prevent them from being readmitted. It's very tough to accomplish both of those goals at once. So there's a lot of appetite for our solution in that space. And then there are, I think we're up to about 218,000 patients that will onboard this year alone, just from the skilled nursing facility space.
Based in Hamilton, Ontario, with offices in Florida and Texas, Reliq specializes in developing innovative virtual care solutions for the multi-billion-dollar healthcare market. The company's powerful iUgo Care platform for care coordination and home healthcare integrates wearables, sensors, voice technology with intuitive mobile apps and desktop software for patients, families, clinicians, and healthcare administrators, allowing complex patients to receive high-quality care at home, improving health outcomes, enhancing the quality of life for patients and families, and reducing the cost of care delivery. iUgo Care provides real-time access to remote patient monitoring data, allowing for timely interventions by the care team to prevent costly hospital readmissions and emergency room visits. The shares are trading at 54 cents. For more information, please visit the company's website, reliqhealth.com, or by email at ir@reliqhealth.com. Investor relations in the United States is handled by Ben Shamsian of Lytham Partners, who can be reached at 649-829-9701 or by email at shamsian@lythampartners.com. I'm Fiona Forbes for Investment Pitch Media.